Joining me is Gauri Mulekhi, Animal Welfare Strategist, Trustee, People for Animals, Dr. Sanjeev Bagai, Chairperson, Nephron Clinics. I'd like to go to Gauri Mulekhi first. Gauri Mulekhi, what's your point of view?
So considering that the Supreme Court had the power to overrule the letter of the law in the first hearing without hearing anybody else, considering they had the power to do that, the consequences of removal of one component in an ecosystem has an backlash. You know, it cannot basically be as simplistic as it's being made out to be, that one push of a button we remove all dogs and you know, suddenly we have a life like a citizen of New York enjoys. No, there are components, various components that will have a domino effect. Nobody has thought, how would our city be invaded by monkeys or be overgrown with cats if dogs are suddenly removed, or the rodent problem that will surface, because rats and mice live under you know, the urban ecosystem, and they do not surface not because of you and me but because of the scavenging animals that we have. The garbage that we generate in our cities. Now I've heard a lot of people saying that, oh, but you know, there are no dogs in developed countries. Well, we are not a developed country yet. We still have you know, urban solid waste disposal, which is pitiable, and that is what leads to scavenging animals. There is a WHO prescribed scientific methodology which has been adopted as law in this country, and the courts, all courts, are duty bound, oath bound to uphold that law, not to set it aside in simplistic manners such as what we saw today. We are hoping that finally, you know, sense will prevail, because this will have an absolutely devastating effect on our ecology. It's not. Suggestions came out today from senior counsels in court that you know, dogs can be left on the Delhi Ridge. Like, imagine the devastation that that would cause to the ecosystem, to the urban wildlife, to the you know, very delicate and fragile ridge area. For 10 lakh dogs to be kept in shelters, it's not even possible. And you're right, Preeti, 10 lakh dogs cannot be housed anywhere. Delhi currently has zero housing space for lifetime care for dogs.
Dr. Bagai, you're a big votary that we remove, you know, dogs from Delhi streets, and you come from a, you know, point of view. We've seen so many attacks where children are concerned or even citizens are concerned. But when you listen to a Gauri Mulekhi, because, you know, we might want to look and feel like a developed country, and we really are not, where dogs clearly are a part of the scavenging chain.
Good evening. I think we must separate the two basic issues. The first issue is that the stray dogs, which are a huge risk to small children, elderlies, and even adults of all age groups, infants, cannot be inhabited where housing colonies are and where residential people live. They go to the parks, they play. It's a huge risk. This is obviously a catastrophic problem. Various kind of figures are available, ranging from 70 million stray dogs to 120 million stray dogs. But the real fact of the matter is that almost 1/3 of the world's rabies cases exist in India. We are losing more than 20,000 human beings because of rabies every year. Now, rabies is an endpoint, but there are a lot of mutilating injuries. There are falls in elderlies who are running away from dogs and so on. This is unacceptable. When you're looking at a figure which is devastating as far as health is concerned, physical risk is concerned, endangering life is concerned, you can't have people feeding dogs on the streets and in a very romanticized manner. Under no set of circumstances am I saying there should be cruelty to animals. No. But the Supreme Court judgment is correct because it's the first step in the correct direction. Maybe the time is short, maybe the resources, infrastructure, capacity building will take time, but it's a step forward in the correct direction. Having street dogs, it is impossible to sterilize them and put them back on the streets. It's impossible to vaccinate them. Over a period of next few years, by housing them in a particular place, looking after them, sterilizing them, the birth control will go down and the total number will go down.
Okay.
Believe me, anyone who's worked in the medical field, especially in the rabies ward, would understand what it is to treat a patient with rabies. Anyone who has treated patients with dog bites would know what a devastating, lifelong
Preeti, may I come
physical
in?
and emotional scar it
Okay,
leaves
I'm
on
going to allow
people.
him to finish, ma'am. Okay, Gauri Muleki wants to come in. Go ahead.
Yeah,
Ms. Muleki, go
it
ahead. Yeah.
had been placed before the bench today that not a single rabies death of any human in Delhi has happened in the past 3 years. This fact basically contradicts everything else that we heard about rabies deaths being on a high. They have actually come down since the animal birth control program has been implemented. In Delhi, the implementation leaves much to be desired, and for that, the Delhi High Court is already hearing 3 petitions and also a contempt petition where the NCD had been pulled up for having 20 animal birth control centers and yet not being able to enforce the animal birth control rules correctly like other states have done. UP has done very well in that regard. Uttarakhand has done very well in that regard, where well-monitored programs in proper animal birth control centers are going on, and therefore puppy citing is less, lactating mother citing is less, dog biting is less, the aggression in dogs have gone down, and generally the dog population has stabilized and it's reducing.
Okay.
Same can be done in Delhi, not this knee-jerk thing, because this will basically mean creation of concentration camps, which the medical doctor will agree is going to be a much bigger public health hazard than the presence of neutered and vaccinated street dogs.
Dr.
amongst
Bagai, would you
us
want to
in
weigh
this
in on
country.
that?
Yeah, so I think two things have to run in parallel. I think one is the law and the implementation. Second is the capacity building, infrastructure, resources, manpower to round up the dogs and look after them, sterilize them, vaccinate them. We need a cost economics also going into this. But not to begin the path is not to begin at all. You're allowing people to have dog bites. Now, I heard the esteemed speaker saying that there have been no reported rabies. The issue is a lot of cases of dog bites and indeed rabies go underreported and undiagnosed and undocumented. That's a published fact. I can give you reference sources of this information. Point number two is rabies is an endpoint. What about the people who have had mutilating injuries? What about the people who've fallen down from dog bites? What about the people who had fracture neck, femur, and fracture elbows? Major orthopedic crisis. What about the small children who've lost their limbs? These are realities.
Okay.
Please
Gauri,
understand,
would
these
you?
are not figures which are
I
documented
can answer
in a
that.
Gauri, because
medical
this is an urban
diagnosis.
reality
Right.
right now. You know, the kind of
So,
videos that come
earlier
out,
this
any
year,
other. Yes, make your point. Make your
So-
point.
Correct. So the dog bite numbers are truly startling, and that is why the Ministry of Health and Family Welfare, Government of India, had been delving into it. Earlier this year, the Director General Health Services came up with a circular for directions for all state governments to asking them to record the dog bites in a particular format, which requires them to indicate whether the dog was a pet dog or a street dog, and also to ensure that for every consecutive dose of the post-exposure rabies vaccination, not a new dog bite is being recorded, because that's how it was earlier being done. Every vial that was dispensed for post-exposure rabies vaccine, a new dog bite would be recorded, even if it's a cat bite or a monkey bite or a rodent bite or a pet dog bite or anything. While all dog bite numbers finally get attributed to street
Okay.
dogs, and then, you know, finally the entire blame is on them. The
Okay.
correct data is not before us. If we have correct
Okay.
data, only then the correct solution
Dr.
can
Bagai
be,
wants to come in, and then that's
implemented.
all
If
the
the
time that we
pet
have
dog
for
bites
now.
are more because
Yeah,
of
just a,
Rottweilers and Huskies
Dr. Bagai,
and
make your point.
you name
yeah,
it,
just a quick point. I think a lot of focus is on anti-rabies vaccine. That's not the only treatment which is internationally and nationally recommended. A lot of lacerating wounds, grade 2 to grade 3 wounds, a lot of head, face, neck wounds require immunoglobulin injections. Please understand, this is frightfully expensive even for
Okay.
affluent people. A routine family or a poor family cannot afford this. If a person doesn't
I was
be
just talking
diagnosed
about
with
data.
this
I was just
diagnosis,
talking about the data being right.
yeah,
Okay.
just allow me to complete, please, ma'am. All what I'm saying is it's a more cost-effective journey in the long run by rounding up these dogs and housing them, sterilizing them, and vaccinating them, rather than have human beings with injuries, mutilation, rabies,
Okay.
and other kinds of infection, which
You
includes
know,
tetanus. Not
I
fair.
think because Because the Supreme Court order has led to so much conversation. We have many WhatsApp groups witnessing exactly the kind of debate that we saw right now on the network. I appreciate both of you taking the time out and joining us. We're going to let our viewers decide on where they stand on this particular highly emotive issue. We're going to leave it at that. Thank you for watching.